And what's really at issue here is the right to humane treatment versus the right to effective treatment. Everybody's in favor of humane treatment. But sometimes when humane treatment is codified by the licensing agencies and the legislators, it's codified at the expense of effective treatment. When certain types of interventions are necessary to keep people safe and to keep other people around that individual safe, and those are removed, an organization is faced with a dilemma of whether they can actually continue to serve that person effectively and safely. And the advocacy groups, and the thing about the advocacy groups is many times those are comprised of people who've had individuals who've been injured or killed during a restraint, so I totally understand their perspective. But people lose a perspective of effective treatment in lieu of just perseverating on humane treatment. So, in this situation, if you're not allowed to restrain people, if you're not allowed to touch people, what are you going to do? Who are you going to call? Ghostbusters. They're not going to come. So what are your options in a situation like this? This person responded a little too late to a crisis situation. What, that's not funny? Okay, so what are your options? Psychotropic medication, is that an option? Relocating others away from the situation that's the crisis, calling 911. Let's look at these briefly. Is medication really an option? A lot of individuals with severe behavior problems are on increased levels of psychotropic medication to make them more manageable, but in the heat of the moment when somebody's trying to take your face off, that's not really an option. And medications, this slide didn't come out so well. There we go. Are fraught with all sorts of potential side effects. And it's interesting, cognitive dulling, which is a major side effect of many psychotropic medications, is the main reason that these medications are prescribed to many individuals with intellectual and developmental disabilities. It's a side effect, but the cognitive dulling meant to slow them down is why it's prescribed. So we're slowing down individuals with cognitive dulling as a side effect with individuals who already have an impaired ability to learn. Do you think this affects their ability to learn replacement behaviors, which would actually make the need for restraint much less? And while we're on the topic of medication, just parenthetically, that's why there are parentheses on the side there, medication errors injure and kill many, many people in this, and that should be 7,000, not 700. I left a zero off there. So medication is not without its risks as well. And then just looking at medical mistakes in general, many of these are related to surgery, we can assume. Another 400,000 individuals in this country die a year. So how do those numbers compare, medication errors and medical mistakes, to the use of restraints? Well, the numbers are hard to get, but the Hartford Courant, a newspaper, in 1998 published an article that found 142 deaths in the previous 10 years. That's based on the numbers they could find. Subsequent to that, the Harvard Center for Risk Analysis estimates that, that between 50 and 150 deaths occur each year in the United States. So talking about desperate remedies, you know, if anybody gets injured in a restraint, that's a horrible thing. And if anybody dies in a restraint, it's a ridiculous tragedy. It shouldn't happen. And in most cases, when there have been injuries in restraints, it's because people have not been trained, have not used the restraints correctly. They've compromised individual's respiratory system. But if we're looking at desperate remedies, the numbers for restraints don't even come close to comparing to medical mistakes and medication errors, but nobody's talking about doing away with those, interestingly.